This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what type of collagen is most common? Answer: type I collagen is the most common, making up 90% of all collagen. Question: what are some examples of tissues that contain type I collagen? Answer: type I collagen is found in bone, skin, tendons, dentin, fascia, cornea, and in late wound repair. Question: in which type of condition is there a decreased production of type I collagen? Answer: in osteogenesis imperfecta type I, there is a decreased production of type I collagen. Question: what is the role of type I collagen in bone? Answer: type I collagen is a major component of bone. It is made by osteoblasts, which are responsible for bone formation. Question: is type I collagen present in skin? Answer: yes, type I collagen is present in skin. It helps to provide structural support and strength to the skin. Question: what is the function of type I collagen in tendons? Answer: type I collagen is one of the main components of tendons. It helps to provide strength and elasticity to tendons, allowing them to withstand the forces of muscle contraction. Question: what is the role of type I collagen in dentin? Answer: type I collagen is one of the main components of dentin, a hard tissue found in teeth. It helps to provide structural support and strength to teeth. Question: what is the function of type I collagen in fascia? Answer: type I collagen is present in fascia, a connective tissue that surrounds muscles, bones, and organs. It helps to provide structural support and strength to fascia, allowing it to withstand the forces of movement and physical stress. Question: is type I collagen present in cornea? Answer: yes, type I collagen is present in cornea. It helps to provide structural support and transparency to the cornea. Question: what is the role of type I collagen in late wound repair? Answer: type I collagen is a major component of the scar tissue that forms during late wound repair. It helps to provide structural support and strength to the wound, allowing it to heal properly. Question: how is type I collagen synthesized and secreted? Answer: type I collagen is synthesized in the endoplasmic reticulum and Golgi apparatus of fibroblasts and osteoblasts. Then it is transported to the extracellular matrix through exocytosis and form a triple helix structure of 3 alpha chains. Question: is there any disease related to type I collagen? Answer: yes, there are several diseases that are related to type I collagen. These include osteogenesis imperfecta, Ehlers-Danlos syndrome, and certain types of skin fragility. Question: how does the defect in type I collagen affect the bone in osteogenesis imperfecta? Answer: osteogenesis imperfecta is a genetic disorder that affects the formation of type I collagen. This leads to weak and brittle bones, which are more prone to fractures. The severity of OI can vary widely, and some forms of the disorder can be life-threatening. Question: how is osteogenesis imperfecta treated? Answer: treatment for osteogenesis imperfecta is based on the type and severity of the disorder and may include physical therapy, bracing, and surgery. In some cases, a bone-strengthening medication may be prescribed. Genetic counseling is also an important part of treatment for OI as the disorder is inherited. Question: is there any other use of type I collagen? Answer: yes, type I collagen has several other uses. It is used in the manufacture of cosmetics, wound healing products, and it is also used as a scaffold for tissue engineering.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.